Okay, this video is about scurvy, and scurvy is a disease that used to be common. The sailors in the 1700s in England had a big problem with it. On long voyages, over 50% of the British sailors would die. They're just throwing lots of bodies overboard because they only would carry with them dry foods that didn't have hardly any vitamin C in it. Vitamin C is especially present in fruits and vegetables, especially the citrus fruits. Once they started giving the British sailors the limes, they called them limeys, they didn't have a problem with it anymore. In the Japanese Navy, they had a problem with giving them too much white rice, and so they wouldn't get thiamine, because when you convert brown rice into white rice, you polish it, you remove the thiamine, the B1 vitamin, so they had to give their sailors barley, some grains, and they would get their thiamine that way. But anyways, as far as being low in vitamin C, the answer is eat your fruits and vegetables. So you need to eat it. There's some paleo-keto carnivores saying you don't need to eat fruits and vegetables, but actually you do. Dr. McDougall said a population will be healthy if you fed them 90% starch, 5% fruits, 5% veggies. So you don't need a lot of fruits and veggies, but you do need some. I probably eat about 35 to 40% of my calories from fruits, another 5% from veggies, the rest from starch. I'm 100% vegan. The populations most at risk would be patients with anorexia nervosa, some pediatric patients that won't eat any fruits and vegetables, alcoholics, institutionalized patients, elderly people on low budget who don't eat much, prisoners, nursing home patients, chronically ill people, smokers. You need that for wound healing too. It's a water-soluble antioxidant. It also helps to replenish the active form of vitamin E. It'll be located, let's say, in the plasma and the cytoplasm, water-soluble compartments. The lipid-soluble vitamin would be more present in the, like E in the membranes. You need to hydroxylate proline and lysine and collagen. That's why I became interested in it with regard to maintaining the ligaments of the spine to prevent back pain. You also needed to hydroxylate HIF, hydroxy-inducible factor, to prevent activation of the hypoxia response pathway for angiogenesis, vascular ingrowth into a tissue. And you don't want that happening in a cancer. So a cancer patient should be eating these things to help maintain a healthy tumor microenvironment. They're also going to be more alkaline, which also helps improve immune function to help remove a cancer. They've got real characteristic findings like perifollicular hemorrhages, meaning little tiny bleeds around your hair follicles, ecchymosis, bruising, increased dental cavities, bleeding gums, gingivitis, corkscrew pattern of the hair. So they're pretty characteristic physical findings. Per one paper, about 10% of Americans were vitamin C deficient. I wonder how many are close to being deficient, and maybe their ligaments are suboptimal. That's what I was sort of interested in. So the bottom line is you got to eat your fruits and vegetables. They're not optional. Those paleo-keto carnivores who said otherwise are wrong. So anyways, that's it on scurvy. It's very easy to find information on it. There's tons of papers on it, tons of videos on it.